This is Rogers TV. The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers nor Rogers TV.
Hello everyone, this is your COVID-19 local update. I'm Deborah Hutchison in the Rogers TV studio. Our first guest today joining us by Zoom is Honor Bastianelli. Honor is the Development Officer Community Programs for Ontario Shores Foundation for Mental Health. That's a mouthful. Honor, thanks so much for joining us.
Oh, thank you for having me, Deb. It's always nice to chat with you guys.
You know, as a foundation, raising money is challenging and has become even more challenging, when there isn't a pandemic there. But during a pandemic, you have really had to, adapt a new approach. Talk to me about the challenges that you have encountered.
Yeah, so we had a number of events that were lined up to take place in person, right kind of out of the gate when COVID first kind of hit really hard, right up through until actually as of this month, we had some events that we had to cancel and some got postponed. So the term that we use in our industry is pivot. It's become quite popular. So we've really had to take apart some of our events that were going to take place in person, and we looked and were able to fortunately turn some of them into virtual events. So you've really had to make some tough decisions and whether or not things could be viable. Unfortunately, we've had some success with some things like paint nights. We've done a virtual comedy night, and we're looking at doing some future paint nights as well. So it's been really, we've had some really good successes and some other ones where we've been challenged just like the rest of the community.
Financially, what sort of impact have you seen so far?
We've definitely been hit there, like I said, like everybody else. It's been very, very difficult. So we rely a lot on our sponsorship opportunities that come through with regards to our events. And unfortunately, like I said, with some of our events being canceled or postponed till 2021, we've had to or sponsors rather have had to take a step back as well and look at their financials. So it's definitely hit our books a little bit harder than we anticipated, but we are already planning for next year, and we're hopeful that we can turn things around and have a positive turnaround come 2021.
Yeah, fingers crossed on that sooner than later. For those that are perhaps unfamiliar with Ontario Shores, how does the foundation support what Ontario Shores does, and why is it so important that people get involved and give?
Sure. So we are the fundraising arm of the Ontario Shores Centre for Mental Health Sciences. Our offices are located right directly within the hospital as well. We are absolutely vital to the hospital, and the fact that we do help provide the funding towards all of the services, whether it be inpatient or outpatient. And we have satellite clinics around in our communities as well. We are located in Peterborough as well. So it is absolutely viable that we have that funding come through so that we can continue to provide these programs through, our research teams, our occupational health therapy teams, so that the patients and their families can continue to receive the absolutely outstanding care that they've received. And I'm going to say, regardless of COVID times, we've been able to continue to operate as a full hospital. And
I would think, we talk so much these days about mental health, and especially during a pandemic, I would think the demands for your services are greater than ever.
Absolutely. Yeah, we're seeing that. I'm sure you guys have seen that as well, being in the media. Mm-hmm. Absolutely. They talk about, the second pandemic is absolutely going to be with regards to people's mental health and how we are handling things coming out of this, and looking forward for the rest of the year. What does that look like for people and their families and kids going back to school? So we are really fortunate. We do have a mental health first aid coordinator that is located within the hospital, and she's actually put together a number of online resources that people can access free of charge help them through and navigate some of these difficult times that we're all helping. And it's available again online so that you don't have to leave your home. And fortunately, some people have really kind of tuned into that, and we believe that it's really helped some.
How can you say online we can access, what is your website?
So the Ontario Shores website is www.ontarioshores.ca.
Okay, easy to remember. Let's talk about some of your fundraisers and your initiatives that are a little different. You have just wrapped up your local beer store donation campaign. Love the idea. How'd you come up with that?
Yeah, so it's really, it was really great. We have a really fantastic relationship with all of our beer stores located in the Durham region. And when COVID kind of first hit us hard in the region and the stats were coming out, we were approached by one of the district managers to say, how can we help? What can we do? And we came up with this great initiative that a few of the participating locations, if individuals were going to come and return their bottles anyways, that they could make the donation if they so choose to with their empties, and that money would come back to the Ontario Shores Centre for Mental Health Sciences Healthcare Worker Fund. So again, that money would go directly towards our frontline healthcare workers. And there ended up being 4 locations in and around Whitby and Brooklyn who participated, and it was a really, really successful campaign, and we're really, really fortunate to have some really great neighbors and friends who participated.
All right, let's talk about the Run for Women brought to us by the Love You by Shoppers Drug Mart program, the Whitby location. That is going viral. That's set for September.
Right. Yeah. So this was one of our events that was supposed to take place. It was going to be June 27th. And again, given the times that we are living in, had to pivot, and we decided that it was best, along with shoppers, of course, that we were going to turn this into a virtual fundraising initiative. So it was wonderful. We were going to have it all take place on the grounds on Ontario Shores. Of course, we have a beautiful, beautiful site. And we were really looking forward to having our very first Shoppers Love You Women's Run take place on our grounds. So we've been working really closely along with the Flow Marketing, along with Shoppers Drug Mart, and we have now been able to make this a virtual event. So it's going to take place, the live streaming of the event will take place on September 27th. Those who are interested in participating and registering can register now. It's up and it's going, and they can actually log their time, whether it be they want to walk or they want to run, they can skip. However they want to get their physical exercise in, they're welcome to do so, and they can log that time in from September 17th all the way to the 27th. And the really, really fantastic initiative that they have put forward is, with the exception of us not all being together, they are still going to provide the really great swag bag, which is a huge incentive for people. So if nobody, or if you're not familiar with it, when you register, you do get a swag bag that is worth over $100, all the Shoppers goodies. And we all love the stuff that Shoppers comes out with.
Yes, we do. Free as good.
Absolutely. And then you also get a commemorative, beautiful bracelet that is part of the Women's Love You campaign. And then the really nice thing too, the give back that Shoppers has given us is at this point, given that charities, as you mentioned, Deb, have been really hit hard during COVID, your registration fee for this race, $40, is going to go back towards the charity. So it's a really, really nice way to make up some of that revenue that we've unfortunately lost. So we are almost at 400 registrants so far.
That's incredible.
It's really, really something. And it gives me goosebumps actually just talking about it, because this is our first year with this run. So given that we've all had to make some changes in our lives and we're not able to do this in person, it's really, really nice to see that people are still wanting to be engaged and looking to be engaged within their community. So we're really, really looking forward to having this virtual or otherwise, but this year it'll be virtual. and having it be a really great success.
Also, the Scotiabank Toronto Waterfront Marathon has gone virtual. You will be one of the benefits of that event as well.
That's correct. So typically, again, this is, like you said, it's virtual, but we normally have a group of about 60 of us who take the bus down 4 a.m. on an October Sunday morning. Sometimes it's been snowing, sometimes it's been raining, and sometimes it's been beautiful. But we raised money, and a lot of it is staff who raised this money for the Ontario Shores Foundation. The greatest needs is where this money usually goes towards funding. So this year, with it being virtual, we are still going to take part. The nice thing about this race is they're giving you a little bit longer or leeway to log your physical activity. So you have from October the 1st to the 31st to participate in this event. And again, it works very similar. You can track it on your Fitbit. There's the Nike Run apps, however you want to. And they've opened up different lengths that you can participate in. So as it used to be a 5K, a half, and a full marathon, they've now thrown in a 10K, which is really nice for people. And their website is really fantastic. It really makes it easy to register, and you get a beautiful commemorative medal, and a really great chance to connect with some of the other people as well. There's Facebook discussion groups where you can chat with other runners and really encourage each other. So this is, I think, our 9th year participating in this, and we're really looking forward to having this take place in October.
Without this money that people bring in through the foundation, what would the effect be on Ontario Shores and its ability to help the community?
Well, to be completely honest, it's a decrease in the programming that we can do, and therefore it affects our patients. So that funding, as I mentioned earlier, goes towards us being able to have the ability to provide our patients with what they need while staying at our facility and when they go back into the community. So it's a really, really tough time for everyone. We recognize that 100%. But the need and the challenge when it comes to, as we talked about earlier with mental health and COVID, is mental health is just as important now as it was yesterday, and it will be just as important as it is, tomorrow. And the phone lines are busy. People are looking for ways to cope and mechanisms that can help them, maintain some sort of normalcy in their lives. Without that funding, we can't be as serviceable as we would like to be. And we want to ensure that especially the Durham community feels like they are being supported and that we'll be there when we need them.
And you never know when you're going to need your services. No one is immune.
That's exactly it. Yeah, you never know. And, the stats do speak for themselves. It is 1 in 5 who will be affected by a mental health illness. So friends, family, extended family, colleagues, there is somebody out there that we all have been in contact with or in our day-to-day lives where they all have, or rather we've all been touched by somebody who
right.
has been affected. So we really, really want the opportunity to stay connected to our community and again, let them know that we are there should they need us.
Okay, Honor, I'm going to stop you there. We're out of time. Thanks so much for joining us. Stay with us. More to come after the break.
Illness doesn't have to be a life sentence. Join me each week on Health 180 with Carolyn as we talk with doctors and other experts about how to reset your life after an illness. Learn health and wellness tips, patient stories, advice, and solutions from professionals on how to be the best you. Together we are stronger. That's Health 180 with Carolyn Fenn right here on Rogers TV.
And welcome back to your COVID-19 local update. I'm Deborah Hutchison in the Rogers TV studio. Joining us now is Gail Nyberg from Feed the Need in Durham. Gail is their board president, and Carolyn Alexander, who works for Feed the Need in Durham in the communications capacity. Ladies, thanks so much for joining us.
Thanks for having us.
Let's talk about your response to COVID-19. The demand for food is always a challenge in meeting that need. But add COVID on top of that, how has that increased demand for your services? Gail, I'll throw that out to you.
Okay, well, certainly we don't have the numbers nailed down, but we know that we have distributed 1.5 times more food over the last 4 months than we normally would. We have less of our members open. We only have 47 of the 62 open because the ones in schools can't open, and that food is flying off the shelves. So we'll have some firmer numbers at the end of August, but we know right now that the demand has been pretty high. As we entered into this, we said to ourselves, what is our primary purpose? And our primary purpose is to collect and distribute food in this region.
And in meeting that need, you've been busier than ever before, but you've also had to navigate, infection control and making sure that your volunteers and your staff are protected against COVID. What sort of protocol have you had to implement?
So, we've been able to distribute that amount of food, which is 1.5 times, with 50% less volunteers, keeping in mind that many of our volunteers were older and were not comfortable with coming in. And we certainly understood that, and we have to keep the social distancing, wearing masks, but our staff and our volunteers at Feed the Need are fantastic, and they've been able to work through this and keep safe and distribute more food than we have ever distributed before.
That is incredible. Have you had difficulty getting access to the PPE that you need?
No, actually, we're fine that way. We've been able to get our hands on stuff. And we've created a couple of new programs. I think one of the ones we're most proud of is Share the Surplus. So we've received a lot of food from Feed Ontario and from the dairy farmers and from Altel Pasta. And we have our agencies coming in twice a week. So we distribute, we take it to them, but they can come on Tuesday and Thursday and take the excess. And we're distributing about 40,000 pounds a week that way. So it's working really well.
And of course, getting it to where it needs to go. Thank goodness you now have your new refrigerated truck that you didn't have last year.
It's fantastic. We had 2 trucks, and we were really doing pretty well. Like, we had a van and a truck, but we were able to lease a refrigerated truck, and that has doubled our capacity for delivery, and we know we're going to need it. We're also purchasing, Deb, a lot. Feed the Need was not into purchasing as much food, but thankfully the donations, the people in Durham have been absolutely fantastic, and they have donated. And so we've been able to purchase $100,000 worth of food, things like tuna, pasta sauce, mac and cheese, and fruit, to make sure what we're sending to the agencies to go out to the people who need the food is stuff they need. So without that truck, it wouldn't have been able to happen.
That is incredible. Carolyn, let me bring you into this. You've also are in the middle of your All In campaign, responding to hunger across the region. Tell me what that's all about and how it's working.
So yeah, our Responding to Hunger campaign is going on right now until August 31st. And it's all about unity in our community and the all in this together response to hunger. So it's a virtual, visual, social campaign. So we have lawn signs and just displaying your community solidarity.
And as far as getting help from the community and getting them, I guess their monetary donations and the food donations, how can people help if they want to reach out to you and help?
Well, there are a lot of different ways that people can help right now, including monetary donations to one of our 3 programs, which is our transportation program, our bulk food purchasing program that Gail just talked about, and our primary mission. And we have also been seeing a lot of unique ways that people are responding to hunger in our community, such as hosting social distancing food drives, drive-through food drives, and fundraising for us. And alongside this campaign, since it's very social and virtual, we've been seeing a lot of people sharing on social media, which helps us raise awareness. We have our Responding to Hunger campaign Facebook frame that people have been adding to their Facebook profile to help raise awareness.
If people want to get involved, what website do they go to?
So they would go to www.feedtheneedindurham.ca/responding to hunger.
Okay. Let's also talk, Gail, you mentioned about volunteers. You've got 50% less volunteers helping you right now just because of COVID-19. If people want to get involved and volunteer, how do they go about doing it?
Well, certainly they can contact us at Feed the Need on the phone number or on what the website that Carolyn just talked about. But we're not in the process right now of onboarding volunteers into the warehouse. We only have 10,000 square feet of warehousing space, and we have to keep social distancing. But if they can volunteer by doing things that Carolyn just talked about, hosting a food drive in their driveway, social distancing, raising money for Feed the Need, but actually coming in to sort food, it's really just not practical right now to be onboarding volunteers.
With how creative people are getting, like their own drive-by, food drives and, food collection parties. How does that make you feel when you see people going out of their way to help others when clearly they have a need as well?
It certainly warms my heart. I have attended 2 so far, both of them in Bowmanville, both of them real estate agents who had music and were giving out ice cream sandwiches, and they were collecting food and money. One was on a Wednesday, one was on a Sunday. It was fantastic, and there were a lot of people coming and going and dropping off food. It warms your heart, especially when you know that they if you're using those 2 real estate agents. I don't think there's a lot of real estate selling right now.
No, we are in the first wave. There is a lot of talk about a second wave, that no pandemic has ever ended without a second wave. Is there a lot of concern that this is only going to get worse, the need for food?
Well, certainly I have that concern. And as we talked about before, I was with Daily Bread Food Bank in Toronto for 12 years. And I went through not a pandemic, but the recession. And people are very generous at the beginning because they understand the need. And people have been so generous. But if we have a second wave and there is no CERB or CERB is reduced, people are not going to be able to purchase the groceries they need. And so we're going to be pinched because although they've been generous, people are not going to be able to be generous if a second wave hits.
And if you reach that point, then how does that impact you, and what can you do to try and meet that need?
Well, we're very fortunate that we belong to Feed Ontario, and Feed Ontario belongs to the Food Banks of Canada. And they have been busily collecting money and food and redistributing out to us. So I think that will be helpful. For instance, Feed the Need or Feed Ontario gave us 9,000 hampers with about $30 worth of food in each hamper. And we were able to distribute those through our network. And one of the decisions we made was to set aside 10% of those hampers for food banks that were not members of Feed the Need Durham, like Operation Scugog, like the Clarington East Food Bank, because it didn't matter to us that they weren't actually members of Feed the Need. They were feeding people, and that's our primary mission, and we knew it was their primary mission.
You know, Gail, you mentioned that you are the retired executive director of Daily Bread Food Bank. You have spent years and years helping people put food on the table. Why do you do it?
Because, I've never been hungry. I've been fortunate. I've never been hungry, and I've never, my children have never been hungry. My husband had always had a good job, and I worked. But I can't think of anything worse than being a parent and thinking that one couldn't provide enough food for their child. And so I've always done it because I never wanted to even imagine what that's like. And so that's one of the reasons I do it. And it's fulfilling, I know it's a temporary measure. I've always fought to change social programs so people didn't need food banks. But in the meantime, they need food banks. And so I want to be there to help.
Carolyn, I want to bring you into the conversation. You work in communications for Feed the Need in Durham. You are one of their summer students. Talk to me about what this experience has been like. You're now in your second summer of working there at Feed the Need in Durham.
Yeah, so I've definitely learned a lot. It was very eye-opening for me, just because you don't really realize the true need that's there until you go out and see it yourself. And I was fortunate enough to get on the delivery truck last summer and be able to go and help distribute food. And yeah, it was very eye-opening to see it rather than just hear about it.
So Gail, we have less than a minute left, but I want to leave it with you for the last few words about the best way for people to help, to get involved, and what you need right now.
Well, first of all, I want to say thank you to the people in Durham who have stepped forward with donations. I ask, if you can afford to give, please give. If you can't, maybe host a food drive in your neighborhood. Every little bit helps. Every little bit helps, and we're going to need the help coming forward, because I think you're right. I think we are going to have a second wave.
Okay, Gail and Carolyn, thanks so much for joining us, and thanks to our viewers for letting us into your home. Until next time, I'm Deborah Hutchison. Stay safe, everyone.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
It's closing time, and you stayed out longer than you planned. So now you can't drive, and the buses have stopped running. You could always